If you have knee arthritis, there's one thing that you must do before considering a knee replacement, and that's to make sure that your arthritis is the real cause of your knee pain. Now, that may sound obvious, but around 20% of people continue to have pain a year after knee replacement. And many of those people may not have been ideal surgical candidates in the first place. There are many different sources of knee pain, even if you have knee arthritis. And one common cause of knee pain is from muscle knots or trigger points. So before you have a knee replacement, it's crucial to make sure that your muscles aren't the cause. Because if they are, you may be able to avoid knee replacement altogether. In this video, I'll share some common muscle causes of knee pain, plus some tips that you can use to relieve them. Now, there are four main muscle groups that can cause knee pain. The most common one is your quadriceps. It's a four-headed muscle, hence quadriceps meaning four heads, and the function of that muscle group on the front of your thigh is to extend your knee. It often works along with your glutes or your butt muscles to help you with tasks such as going upstairs or standing up from a chair. And if your glutes are weak, it can often cause your quads to become overworked and develop trigger points. Now, the second group is your hamstrings on the back of your thigh. Your hamstrings are your main knee flexors. They also function to extend your hips. Additionally, your calf muscles can cause pain in the back of your knee as well. So the hamstrings and the calves can both refer pain to the back of the knee. And the final muscle group is your adductor muscles on the inside of your knee. Those muscles bring your knee towards midline, and you can often develop trigger points in your adductors from sitting with your legs crossed for long periods of time. So I'll share a couple tips to help relieve knots or trigger points in these muscles. But first, it's helpful to understand just what knots or trigger points are. They're essentially hyper-irritable points in muscles that are, by definition, 4 times more tender than normal muscle. Muscle fibers overlap like this, and they expand when you stretch a muscle, and they shorten or contract when you contract a muscle. There are overlapping filaments that kind of ratchet the muscle together when you contract the muscle, and it actually takes energy to release the bond between those myosin and actin fibers. Now, when you develop trigger points, it cuts off the local circulation in the capillaries. And because your muscles aren't getting the circulation and oxygen to produce energy, the muscle fibers stay contracted or locked together. This creates a local energy crisis where your muscles can't get out of that situation. So even if you're stretching, those muscle fibers won't release. But here's some tips that you can use to help release the muscles. They can go from general to specific, and general tips are generally good to cover a large portion of muscle in a short period of time. However, they're not quite as effective or long-lasting as the more specific treatments. So I'll show you various options to release muscle knots going from general to specific. So solution number one is using a foam roller. This is a pretty common thing that people do for knots in their legs, but there are a couple drawbacks. Mostly these are good for larger muscles, so using them on your quadriceps, rolling back and forth like this, or using it on your hamstrings where you roll back and forth like this. It's a little bit harder to use on your calves because your body weight's back here, and so you really don't get a great pressure on the calves. And for that reason, it's probably better to use the foam roller for knots in your hamstrings or in your quadriceps. Now, there are some drawbacks to that as well, in that it's kind of uncomfortable if you already have stiff, sore knots in your legs. And some people have trouble getting on and off the floor. So for that reason, the foam roller is a good solution, but it's not one for everyone. The second option would be to use a massage stick or a muscle roller. You can use this on your quadriceps or your calves. You can use it on your hamstrings, and you can even get it along in your inner thigh muscles here. So you can cover all the different muscle groups, and if you find an area that's especially sensitive or tender, you can focus in on that area a little bit more. So this is a little bit more specific than a foam roller, but you can still hit the whole muscle and cover a fairly large surface in a short period of time. The next option is to use instrument-assisted soft tissue mobilization. That's using a tool to help mobilize your soft tissues or your muscles. Now, you may have heard of various brand names like Graston or Astim, and those are the most common ones used clinically in physical therapy clinics, but gua sha tools have been used since ancient China. And you can buy gua sha tools fairly inexpensively to use them at home. You can use them on any muscle group such as your quadriceps, your hamstrings, your adductors, or on your calves. But you basically just run them up and down the muscle parallel to the direction of the muscle fibers. You want to have them at kind of an angle, not straight down at 90 degrees and not sideways, but kind of at about a 30 to 45 degree angle. And you should feel little knots as you run over a knot or tender area. If you happen to feel one, you can focus in a little bit more on that knotted or tender area. You can do it directly over skin like I'm doing it, or using a lubricant such as cocoa butter does help the tool to slide a little bit more easily and may help make it a little bit more comfortable. The next tip is using a massage gun. This one is the X6 from Bob and Brad, and I like this one really because of the metal head. It gets a little deeper penetration, especially for bigger muscle groups like the quadriceps and the hamstrings. Much like some of the other treatments, you can cover a large area in a short period of time with these, but then if you happen to find a knot or a trigger point, you can localize in on it a little bit more. If you want to get a little bit more specific, it does have a trigger point attachment. You can use this to localize into a single trigger point and just hold it over the knotted or tender area for about 30 seconds to a minute. Now, if you want to get a little more specific yet, that's where you're going to start using manual therapies or using your hands. You can do this at home or see a massage therapist or a physical therapist who does manual physical therapy. And to do this, you're going to run your fingers along the muscles until you find a knot or trigger point. This way you're getting two-way feedback. You feel the tender area in your thigh, but you can also feel through your fingers as to when you hit an area. And you want to try to localize in on the most knotted, most tender area. So you'll find kind of a general area that feels sore or stiff. You can probably feel a ridge or a knot in the muscle, and then roll back and forth over that ridge or knot, kind of slide up and down and sideways along it until you find the epicenter of the knot or the trigger point. Then once you find that, you want to hold a pressure on it for about a minute and a half, possibly longer, up to 3 minutes. But holding a gentle pressure on that trigger point, it may feel a little bit tender at first, but over time you should feel the tension in that trigger point slowly melt away. Now, if you want to get a little bit more specific yet, you can go to a physical therapist who does dry needling. And for that, it'll be even a little more specific because you're not only getting over top of the trigger point, but you're actually putting a little acupuncture needle inside it. Now, this is not a treatment that you would do on your own at home. You would have to go see someone to do this. But essentially, the therapist would localize the trigger point, and then they put the little acupuncture needle inside the muscle. Now, it really doesn't hurt when you put the needle in, but then as you move the needle around, you may feel little zings or feel a little contraction of the muscle. Sometimes you can actually see the muscle jump or twitch a little bit. And I'll see if I can elicit one here just so you can see for the video. But dry needling is another great option. A randomized controlled trial consisting of 40 women with mild to moderate knee arthritis showed that with 3 sessions of dry needling, the group who received dry needling had greater improvements in pain, walking speed, and balance versus the group who did not receive dry needling. So it is a very effective treatment option. It's one that we do here at More for Life in the clinic if you are in St. Louis, or if you're somewhere else, find a therapist near you who does dry needling. Now, after you've released the trigger points, what do you do to keep the pain from coming back? Well, it is a good idea to stretch the muscles immediately after doing the trigger point release, as well as on a regular ongoing basis. And that's particularly true for the quadriceps and the calves. Additionally, it's a good idea to strengthen your glutes. Because again, when your glutes are too weak, your quadriceps get overworked and can develop trigger points. Now, there are stretches in this knee pain relief playlist right up here, as well as a video on how to strengthen your glutes to prevent knee pain down there. But before you go check those out, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos.